I chose this program at Reading Hospital because I wanted a place that felt truly like it was a family.
The first thing that impressed me about the Reading Hospital were the residents. They had a tight group of people who really saw each other as family. They looked for opportunities to hang out with each other, which was not always something that I saw on the interview trail.
Our relationships with the faculty are probably one of our strongest suits of this whole residency program. I think it's a very open environment. You can tell the faculty members about anything.
One of the things that's really great about our residency is that our faculty, all their offices are on the hallway right outside of our resident room, and we spend a lot of time there. They have an open door policy, so they're always available.
The program directors listen to us. They seek our feedback. They try to respond in ways that help us be more successful at the kinds of things we want to do.
One of the things that you should seek out when you're looking for residencies is a program that has a fairly complicated and challenging patient panel, because you are going to want to get exposed to the hardest things you possibly can now, so that you can know what to do and handle it in future practice.
The unique structure of the 3-1-2-2 model, where it's 3 weeks of something and then 1 week of clinic, and then in your third year 2 weeks of something and then 2 weeks of clinic, was really important to me, because in family medicine I feel like learning how to do clinic well is really important to the job, and also having that continuity with patient care is really of essence for me.
Well, one of my first rotations was on pediatrics, and to be fair, pediatrics is a real strong point for our program. We are completely unopposed in pediatrics. We are a level 1 trauma center that is about an hour drive from other pediatric hospitals. We don't have our own pediatric ICU or pediatric specialties, which means being as far as we are, we see some very sick kids, and we don't always have the option of getting them to a big place like Children's Hospital of Philadelphia or a similar type of hospital in a rapid way. So we end up having to be the primary practitioners managing these kids. As a result, our pediatrics training is really strong.
Our program specifically very much emphasizes evidence-based medicine, just constantly pushing us to learn and grow, not just currently as residents, but also developing lifelong learning skills, so that when we're attendings, we continue to innovate, essentially keep up to date on the latest advances in medicine, and just provide the best patient care we can.
The technology that I feel like has been the most helpful for me as I've gone through my training is really embracing the health system, the electronic medical record system, and using what is called M-Modal, which is a dictating software.
Our clinic, our hospital, our outpatient experience, all of that is through Epic, and that makes a huge difference in terms of accessing patient materials. I never have a hard time pulling up images or previous records unless the patient is coming from another state or a completely different hospital system.
Every resident who comes into our program is paired with a faculty advisor, and that faculty advisor is your point person for all the things that come with residency that you need to be successful. They will help you find research projects, they'll help you navigate areas of weakness and strength, they'll help you develop the kinds of things that you enjoy doing within the program. And so that's really helpful to have a faculty member there who's available for that, dedicated just for you.
For me and my entire class, every single one of us, Reading was our #1 choice. All of us. So we all wanted to be here. It's a complicated clinic, it's a challenging group of patients. But I think that that's truly what you want in a residency. You don't want to just slide by and not learn. You want to be pushed, you want things to be challenging so that you'll grow as a physician and be able to be equipped to help your patients going forward.